8 medications that harm memory and brain health. Have you ever considered how the medications we take could impact our memory and brain function? It's a topic few discuss, but one that affects millions. What if the very drugs meant to help us were quietly harming our cognitive health? Research reveals a critical truth. Memory loss is not a natural consequence of aging. Yet, certain medications are directly linked to cognitive decline, and their risks often go unnoticed. Some of these drugs are prescribed regularly, while others are purchased over the counter. Could you or someone you love be at risk without even knowing it? Take proton pump inhibitors, for example. Medications like omeprazole, commonly used to treat acid reflux, have been associated with dementia. Then there are anticholinergics, frequently prescribed for conditions such as Parkinson's disease or bladder issues, which are known to impair memory and brain function. These are just a glimpse of the hidden dangers. Why do these medications pose such serious threats to the brain? The reasons vary. Some interfere with neurotransmitters essential for memory and learning, while others disrupt the delicate balance of chemicals our brains rely on. What's more concerning is how self-medication and prolonged use amplify these risks. But there's hope. By identifying these medications, we can make informed choices and take proactive steps to protect our cognitive health. In this video, we'll explore 8 common drugs that could be affecting your brain. Pay close attention. Medication number 7 is shockingly harmful, yet few are aware of its dangers. We've included every reference we used in the description below so you can dig deeper into the research. Together, let's uncover the facts, dispel the myths, and learn how to safeguard our most vital asset, our brain. Ready? Let's begin. Aging and dementia, unraveling the myths. For years, dementia and cognitive decline were widely regarded as unavoidable companions of aging. However, groundbreaking research has revolutionized our understanding, revealing that memory loss is not an inherent aspect of growing older. Dementia, including conditions like Alzheimer's disease, arises from specific pathological processes within the brain rather than the mere passage of time. Emerging studies bring hope, demonstrating that cognitive abilities can remain sharp or even improve with the right interventions. Maintaining brain health involves managing risk factors and embracing habits that support neural vitality. A nutritious diet, consistent physical activity, mental challenges, and strong social connections serve as vital pillars of a resilient mind. Chronic conditions such as diabetes and hypertension, when managed effectively, further reduce the risk of cognitive decline. Yet, the story is more complex. Hidden threats to brain health lurk in everyday life. Excessive alcohol consumption, smoking, untreated brain injuries, strokes, and chronic stress silently erode cognitive reserves. Nutritional deficiencies, especially in vitamin B12, and untreated mental health conditions also amplify the risk of decline. Addressing these factors is essential in safeguarding cognitive function. At the heart of dementia lies a microscopic battle. Proteins like tau and beta amyloid accumulate to form tangles and plaques that disrupt and destroy brain cells. While genetics may increase susceptibility, they do not dictate destiny. Lifestyle choices and environmental factors hold substantial power in modifying these risks, underscoring the role of proactive prevention. The fight against dementia requires a holistic approach, promoting a brain-healthy lifestyle, addressing chronic illnesses, and leveraging advancing medical interventions are crucial steps. Researchers continue to unlock innovative therapies aimed at slowing or preventing cognitive decline, pushing the boundaries of what is possible. Unveiling the hidden causes of memory loss. Memory loss is more than a simple consequence of aging. It's a multifaceted issue influenced by numerous surprising factors. While conditions like Alzheimer's or dementia are widely recognized, many lesser-known triggers often go unnoticed. Substance use can significantly impact brain function. Excessive alcohol consumption damages neurons and disrupts cognitive pathways, while tobacco weakens blood vessels, reducing oxygen flow to the brain. Both habits silently harm mental clarity over time. Traumatic brain injuries, whether from sports, accidents, or falls, are another cause. These injuries may result in immediate memory lapses or lead to gradual cognitive decline, such as chronic traumatic encephalopathy. Strokes stand out as a leading yet preventable cause. When blood flow to the brain is interrupted, cells in affected areas die, impairing memory and other vital functions. Sleep, often underestimated, plays a critical role in memory consolidation. Insomnia and other sleep disorders disrupt this process, making it harder to store new information or retrieve past experiences. Chronic stress quietly undermines cognitive health. Prolonged exposure to cortisol, the stress hormone, damages the hippocampus, a key structure for storing and recalling information. Nutritional deficiencies can also take a toll. A lack of vitamin B12, crucial for healthy nerve function, can lead to confusion, forgetfulness, and long-term neurological damage. Mental health challenges add further complexity. Depression dampens focus, making it harder to absorb or retain knowledge, while anxiety overstimulates the brain, hindering its ability to process and store information effectively. These emotional hurdles often go untreated, compounding the problem. Memory loss isn't a single-issue concern. It's shaped by interconnected physical, psychological, and lifestyle factors. Medications that could harm your memory, what you need to know. Certain widely prescribed medications, while effective in treating various health conditions, may pose unexpected risks to your memory and overall cognitive function. Many patients remain unaware of these potential side effects, which could significantly impact brain health over time. Let's delve into how specific medications may harm cognitive abilities and the brain itself. 8 medications known to affect memory. 1. Omeprazole, the overlooked threat to cognitive health. Omeprazole, a popular treatment for conditions like heartburn and acid reflux, belongs to a category of drugs called proton pump inhibitors, PPIs. This group also includes lansoprazole, pantoprazole, and esomeprazole. PPIs effectively reduce stomach acid, offering relief for digestive issues, but their long-term use carries hidden dangers for the brain. Research highlights concerning trends. One study involving approximately 6,000 participants revealed that 10% of those who used omeprazole for more than 3 years experienced memory loss. Another investigation showed that 33% of long-term users, those exceeding 4.5 years, reported cognitive impairments. The reasons behind these cognitive effects are multifaceted. PPIs can hinder the absorption of vitamin B12, a nutrient essential for brain and nerve health. A deficiency in B12 can lead to neurological disorders and memory-related issues. Furthermore, PPIs are known to disrupt gut microbiota, an ecosystem intricately linked to mental and cognitive well-being. The accessibility of PPIs without a prescription often leads to their overuse. Patients may begin prolonged treatments without fully understanding the associated risks. However, experts strongly recommend seeking medical guidance before initiating or continuing extended use of these drugs. Proper evaluation of conditions like gastritis or ulcers is essential for determining whether PPIs are genuinely necessary. For most patients, PPI treatments should be limited to short durations, typically ranging from 2 weeks to 3 months. In addition to memory concerns, extended use of omeprazole has been linked to vitamin deficiencies, kidney damage, increased fracture risks, and heightened susceptibility to respiratory and intestinal infections. The path forward: caution and consultation. We must prioritize safe and informed use of medications, consulting healthcare providers, adhering to prescribed durations, and exploring alternative therapies can minimize risks to cognitive health. By approaching treatments with care, we can protect both our immediate well-being and our long-term mental clarity. Understanding the broader impact of commonly used medications allows us to make wiser choices that preserve not just physical health, but also the sharpness of our minds. The second one, anticholinergics, unveiling the hidden risks. Anticholinergic medications are commonly prescribed for various health issues, ranging from Parkinson's disease and overactive bladder to certain respiratory conditions. These drugs work by inhibiting acetylcholine, a neurotransmitter essential for processes like learning and memory. While undeniably effective in treating specific ailments, the potential risks of anticholinergics, particularly on brain health, cannot be ignored. Prolonged use has been linked to alarming consequences, including a heightened risk of cognitive decline and dementia. A landmark study conducted at the University of Washington tracked over 3,500 older adults for a decade. The findings were striking. Regular users of anticholinergics face 54% higher likelihood of developing dementia, with the risk amplifying as dosage and duration increased. Certain anticholinergics, such as scopolamine, meclizine, atropine, benztropine, oxybutynin, trihexyphenidyl, and dimenhydrinate, are frequently implicated in these cognitive issues. By blocking acetylcholine, these drugs disrupt critical neural communication pathways, impairing both learning and memory. Interestingly, not all anticholinergics carry the same level of risk. Medications like glycopyrrolate, trospium, tolterodine, darafenacin, fesoterodine, tiotropium, and umeclidinium, particularly when inhaled, appear to have a far safer profile concerning cognitive effects. The widespread and sometimes indiscriminate use of these drugs, especially among older adults, raises serious concerns. Thoughtful decision-making is essential. Patients and healthcare providers must weigh the benefits against the risks, explore safer alternatives, and minimize use by adhering to the lowest effective doses for the shortest possible duration. Beyond cognitive challenges, these medications can trigger side effects such as dry mouth, constipation, urinary retention, and blurred vision. Understanding these risks is vital, especially for vulnerable populations. 3. Corticosteroids, the hidden impact on your brain. Corticosteroids are a cornerstone in the treatment of many conditions, including asthma, allergies, autoimmune diseases, and chronic inflammation. They work wonders for controlling symptoms, but their prolonged use, especially in oral form, can take a serious toll on mental health and cognitive function. While these drugs are life-saving, their effects on the brain should not be underestimated. Research has shown that corticosteroids can cause noticeable structural changes in the brain. These changes can lead to confusion, memory loss, disorientation, anxiety, and even depression. A large-scale study in the UK, which followed more than 500,000 individuals, found that long-term users of corticosteroids for asthma faced a significantly higher risk of developing mental health issues, including dementia. Among corticosteroids, glucocorticoids like prednisone and dexamethasone are particularly concerning. They can alter the balance of cortisol, a hormone that is naturally produced in response to stress. Excessive cortisol can damage neurons in the hippocampus, the brain's center for memory and emotional regulation. This disruption can lead to cognitive decline and emotional instability, especially with long-term use. Inhaled corticosteroids, such as fluticasone, budesonide, and mometasone, are often viewed as safer alternatives because they primarily target the lungs. However, when used in high doses or for extended periods, these medications can still have harmful effects on the brain. The misconception that inhaled corticosteroids have no systemic impact is gradually being dispelled by emerging research. The risks of corticosteroids extend far beyond mental health. Chronic use of these medications is also linked to physical conditions like osteoporosis, high blood pressure, diabetes, and increased susceptibility to infections. These side effects can severely affect a patient's quality of life, making careful monitoring and management essential. To mitigate these risks, healthcare providers should prioritize the lowest effective dose for the shortest duration. Patients should be made fully aware of the potential mental and physical side effects. Whenever possible, non-pharmacological therapies should be explored. Physical therapy, lifestyle changes, and new biologic drugs are all valuable alternatives that may reduce the need for corticosteroids, offering a safer approach to managing chronic conditions. Understanding the full impact of corticosteroids on both the body and brain is critical. As we continue to uncover more about their long-term effects, it becomes increasingly clear that responsible use, guided by medical expertise, is key to preserving both mental and physical health. For benzodiazepines, the hidden threat to memory, benzodiazepines, a widely prescribed class of drugs, are commonly used to treat anxiety and insomnia. Medications like alprazolam, diazepam, and lorazepam offer quick relief by calming the nervous system. While they provide short-term benefits, their long-term use can silently jeopardize brain health, particularly memory. Extensive research has revealed a concerning connection between prolonged benzodiazepine use and memory loss. Studies show these drugs can significantly increase the risk of developing Alzheimer's disease, potentially doubling the chances of onset due to lasting brain damage. One study highlighted that over 40% of benzodiazepine users experienced neurological symptoms, including concentration difficulties, fatigue, heightened anxiety, and hypersensitivity to sensory input. The consequences extend beyond memory impairment. Long-term use of these medications can contribute to sleep disturbances, persistent anxiety, muscle weakness, and myalgia. The risk of emotional and physical dependence also looms large, making it difficult for many patients to stop taking these drugs. The link between benzodiazepines and Alzheimer's raises particular concern. Though the exact cause remains unclear, it's believed that these drugs interfere with neurotransmitter function, potentially causing both structural and functional damage to the brain. Furthermore, benzodiazepines disrupt the natural sleep cycle, which is essential for effective memory consolidation. Given these risks, it is critical that benzodiazepine use is carefully managed. Doctors should prioritize non-drug alternatives for treating anxiety and insomnia, such as cognitive behavioral therapy, relaxation methods, and lifestyle changes. When benzodiazepines are necessary, they should be prescribed for the shortest duration at the lowest effective dose. Understanding the risks of prolonged benzodiazepine use is vital in safeguarding brain health. By raising awareness, we can encourage safer, more effective treatments for anxiety and insomnia, helping to protect memory and cognitive function in the long run. 5. Amphetamines and the memory trap. Amphetamines, including the widely known Adderall, are commonly prescribed for managing attention deficit hyperactivity disorder, ADHD. These medications are celebrated for their ability to boost concentration and reduce hyperactivity, offering immediate relief for many. However, the long-term use of amphetamines carries hidden dangers, especially in terms of memory and cognitive health. These drugs work by increasing the levels of key neurotransmitters such as dopamine and norepinephrine in the brain. This surge temporarily enhances focus and mental clarity. However, when used over extended periods, the benefits diminish, giving way to serious consequences. Chronic use can lead to physical and emotional dependence, sleep disturbances, heightened irritability, and even depressive symptoms. One of the most alarming side effects is memory impairment. Research has shown that prolonged or high doses of amphetamines can lead to irreversible brain damage. While memory problems are the most noticeable, long-term users often report a decline in motivation and a general decrease in cognitive abilities. Surprisingly, these impairments can linger, sometimes even after discontinuing the medication, suggesting lasting neurological harm. Beyond memory loss, another major concern is the risk of addiction. Due to their stimulating effects, amphetamines are frequently misused, putting individuals at risk for severe complications, including heart issues, gastrointestinal problems, and in extreme cases, sudden death. Psychological dependence can be just as challenging, with users finding it difficult to quit, even when faced with clear negative effects. To protect patients from these risks, it is vital that amphetamines are prescribed with caution and closely monitored by healthcare providers. Patients must be fully informed about the potential side effects and encouraged to follow dosage guidelines strictly. In addition, exploring non-pharmacological treatments such as behavioral therapy and stress management can offer valuable alternatives for managing ADHD. NASA 6, first-generation antihistamines, quick relief, hidden risks. First-generation antihistamines like chlorpheniramine and diphenhydramine are widely used to relieve allergy and cold symptoms. They offer fast relief, calming congestion, itching and sneezing, but beneath their effectiveness lies a darker side, hidden risks that can harm cognitive health. These medications block histamine, which causes allergy symptoms. However, they also interfere with acetylcholine, a neurotransmitter critical for memory and learning. Over time, this can impair cognitive function, especially with long-term use. Studies have shown a concerning link between prolonged use and dementia. A review of over 130 studies found a strong connection between these antihistamines and cognitive decline. Even after stopping the medication, many users continued to struggle with memory issues and difficulty concentrating. Fortunately, there are safer options. Second-generation antihistamines, such as loratadine and cetirizine, provide effective symptom relief without the cognitive side effects. These alternatives are a better choice for long-term use, allowing patients to avoid the dangers of older drugs. In addition to cognitive concerns, first-generation antihistamines can cause drowsiness, dry mouth, and blurred vision. These side effects can significantly disrupt daily life, particularly in the elderly, who are more susceptible. For long-term allergy relief, it's essential to consult with a healthcare provider before relying on first-generation antihistamines. Exploring safer alternatives and implementing other allergy management strategies such as dietary adjustments and environmental changes can help minimize reliance on these medications and protect brain health. 7. Tricyclic antidepressants and memory loss. What you need to know. Tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline, were groundbreaking when introduced in the 1950s to treat depression. While effective for managing depressive symptoms, these medications carry significant cognitive risks. Memory loss and mental fog are among the most concerning side effects. TCAs function by increasing serotonin and norepinephrine in the brain, enhancing mood. However, they also block acetylcholine, a neurotransmitter essential for memory and learning. This interference with cognitive processes leads to problems with focus, memory recall, and mental clarity. Studies highlight a disturbing connection between TCAs and cognitive decline. A 2018 study in the Journal of Clinical Psychiatry found that patients on long-term TCA treatment experienced cognitive decline 40% faster than those not taking these drugs. Symptoms such as forgetfulness, confusion, and concentration difficulties are common. The risks are even more pronounced in the elderly, who are more sensitive to these medications' anticholinergic effects. Research in The Lancet Psychiatry 2020 revealed that older adults taking TCAs were at a significantly higher risk for developing dementia. This group is particularly vulnerable as their ability to process acetylcholine decreases with age. For older patients, the cognitive consequences of TCAs can be severe. Fortunately, advances in antidepressant treatments have provided safer alternatives. Selective serotonin reuptake inhibitors, SSRIs, like fluoxetine and sertraline, have become the go-to option. These medications are less likely to cause memory problems, with a 40% lower risk of cognitive side effects compared to TCAs, according to a 2023 study published in JAMA Psychiatry. Beyond memory loss, TCAs also cause other unwanted effects, including dry mouth, blurred vision, constipation, and weight gain. These side effects can severely impact daily life and lead many patients to discontinue treatment. Given the potential risks, it's crucial for doctors and patients to carefully weigh the benefits and side effects of antidepressant options. Regular monitoring is essential, especially for older individuals who face heightened risks. Safer alternatives like SSRIs should be considered to minimize cognitive impairment and improve long-term outcomes. 8. Statins, the paradoxical on cognitive function. Statins, such as atorvastatin and simvastatin, are commonly prescribed to reduce cholesterol levels and prevent heart disease. These medications are highly effective in lowering the risk of heart attacks and strokes, providing significant benefits for cardiovascular health. However, recent research reveals a growing concern. Prolonged use of statins may affect cognitive function in some individuals. Although most people tolerate statins without issue, some experience troubling side effects, including memory problems and mental confusion. These cognitive effects, though not widespread, can have a significant impact on quality of life for those who are affected. It's thought that statins may interfere with the production of cholesterol in the brain, a crucial element for synapse formation and proper cognitive function. The relationship between statins and cognitive decline remains complex. While some studies suggest that statins may offer protection against dementia and Alzheimer's disease, others indicate a potential link to memory problems. This contradictory evidence likely stems from variations in study populations, doses, and treatment duration. Further investigation is necessary to fully understand the impact of these drugs on brain health. In addition to cognitive concerns, statins are known to cause other side effects such as muscle pain, weakness, and digestive issues. These effects can severely affect daily functioning and may even lead some patients to stop treatment altogether. As a result, balancing the benefits and risks of statin therapy is essential for optimizing patient care. To mitigate potential risks, patients and healthcare providers must engage in open discussions about the possible side effects of statins. Regular monitoring of cognitive symptoms is vital, as adjustments in dosage or a switch to a different statin may alleviate unwanted effects. Alongside medication, maintaining a healthy lifestyle through proper diet and regular exercise plays a crucial role in managing cholesterol levels and minimizing reliance on pharmaceuticals.
Conclusion?
Safeguarding your cognitive health. Self-medication and the extended use of certain medications can lead to serious consequences for memory and cognitive abilities. In this article, we explore how some commonly prescribed drugs such as anticholinergics, steroids, benzodiazepines, amphetamines, first-generation antihistamines, tricyclic antidepressants and statins can negatively impact brain function over time. It's essential that patients always seek guidance from their healthcare providers before starting or continuing any medication. Open, informed conversations about potential risks, benefits, and alternative options are vital for safeguarding both cognitive health and overall well-being. Thank you for watching. Don't forget to subscribe to our channel, share your thoughts or experiences in the comments below, and pass this important video along to your family and friends. Wishing you health, happiness, and success. See you in the next video.